Dr. Patrick Harlan. I'm one of your veterinarians here at Imperial Highway Animal Clinic. Here at Imperial Highway Animal Clinic, we try to keep up with the latest techniques and approaches for veterinary surgery. Our technicians are trained to assist our doctors with cutting-edge surgical and anesthetic equipment so that we can provide safer and less invasive options for routine procedures that your pet may need. This in return means quicker and less painful post-operative recoveries for our patients. The most common and well recognized of routine procedures is probably the spay and the neuter. Each of these surgeries is meant to achieve sterility by removal of the reproductive organs. These procedures may be recommended for your pet in order to lessen aggressive behavior, prevent accidental mating, assist in resolution of hormone-driven diseases, facilitate healing of inflammatory or traumatic conditions, and lastly, prevent certain types of cancers. At our hospital, we offer not only your traditional spay and neuter, but we're also equipped with vessel sealing and laparoscopic capability. Now I'll go into brief detail walking you through the differences between each of these procedures and their variations and the benefits they provide. First off, with the traditional spay and neuters, there will be a midline opening made under the belly or groin through which we access the reproductive organs. Deeper tissues and other contents in the belly are exposed to environmental air during this procedure, which can pose a risk of infection. Stitches are utilized to close the opening made at the beginning of the operation, as well as tie off vessels to prevent bleeding once the reproductive organs have been removed. Although this method is tried and true, length of the recovery and post-operative pain can vary depending on incision length and activity of your pet following the procedure. Our vessel sealing option is a modification of the traditional spay and neuter, which utilizes a special instrument that clamps the blood vessel and seals off the blood supply before the vessel is cut away from the organ. Think of it similar to a food vacuum sealer. This in turn controls bleeding without the use of stitch material that would otherwise be left in the body after the organ is removed. There will still be an incision line under the belly or groin that can vary in length, as well as exposure of the abdominal contents prior to removal of the organ. Lastly, we have our latest minimally invasive surgical approach achieved with our laparoscope. We call it the Love Spay, which stands for laparoscopic ovariectomy. With this technology, we are now able to remove the reproductive organs in our female pets without a surgical incision line and without exposing abdominal contents to environmental air. Instead, we make 2 portholes in the belly through which we introduce a camera and a vessel sealing instrument, and allowing us to visualize, isolate, clamp, and seal off the reproductive organs and subsequently remove them through the portholes. This technique reduces risk of infection, reduces bleeding, reduces handling or disturbances of the other organ tissues, as well as reduce post-operative pain. Post-operative care and restrictions for this technique are the same as the previous procedures, but your pet will be much more comfortable during that time. Applications of this technology for our male pets can only be employed if 1 or more testicles are retained. We call that the laparoscopic assisted cryptorchidectomy. Well, that was a quick summary of some of the routine procedures and their variations that we offer here at our clinic. We look forward to seeing you in our hospital for any of your pet's healthcare needs. Thank you.